Okay, so we have Naomi here with us today. Naomi, if you could please share your name and the current organization that you work for.
Yes, my name is Naomi Torres, and I am a community health worker for the school health program at Metro Health Medical Center.
Oh, wonderful. That's such a great program.
It is.
It really is.
Very rewarding.
Thank you so much for being here today for CHW Day and for participating in this podcast. So we just wanted to ask you a couple of quick questions.
Yes.
Could you describe a day in the life of a CHW, especially in your role from your perspective at the School of Health program?
Yes. So a regular day as a community health worker in the school health program is different. We are very hands-on with the students at the schools. So day in a life, we have a Metro Health clinic inside the schools. We focus on getting kids to be seen in the clinics at the school. If we don't have a clinic at the school, then we have a mobile that comes out to the schools. We provide dental services. We provide medical services. We do sports physicals, work permits, all type of different appointments throughout the day. So my day would start as a community health worker, but also as kind of like front desk, make sure that we have a staff full, or our staff is full of appointments. Being in a school setting, the students are brought into the office. So we also see students that are having emergencies at the school. High schools are even more rewarding because students take advantage of parents that don't have the ability to take them to the doctors or to be self-aware of their own medical needs as teenagers. So they come in and we reach out to the parents, make sure that we have their consent on file to be able to provide services for them. Once our clinic is done, then as a community health worker, I have many different gaps to fill. And that can be like some students don't have medical insurance. So we reach out, make sure that we can get them covered, some type of coverage or, insurance of somewhat. We also make sure that they have appointments that they're needing, whether it's physical therapy, whether they need behavioral health services. We also have a therapist come to the school with us and be there for the students when it comes to providing that mental health appointments for them. Let me see. And then what else? It all depends. It's from morning to the end, but it can be medical insurance. It can be getting them supplies, needs, necessities that the family is not having at home, food insecurities. A lot of the students have food insecurities, unfortunately. Going to go get food for them, dropping it off at their homes type of thing. Also, there's one of the needs is being able to provide resources for parents not having the housing or the electricity being cut off or shut off notices and transportation to their appointments, whatever is keeping the students from having the appropriate help that they need, and the parents are not being able to for lack of transportation or other basic needs that they might have, then we fill in the gap.
Wow. It sounds like you wear so many different hats, and I truly feel like that's the theme of what a CHW really does, filling all those different gaps, wearing all those different hats to try to help meet patients where they are and provide the help that they need.
Yes.
It sounds like you're doing amazing work with the school health program. Can you give us a little insight into what is your why?
The reason why I love being a community health worker, because you got to love it to be able to do it, right?
Oh, sure.
So the reason I love being a community health worker is because you don't walk around with a title, but you kind of like put yourself in the shoes of who you're helping. So it can be someone completely going crazy because they're desperate, and you have to step up and bring the situation down, calm them down, and make sure that they leave knowing that they have the help, the resources possible, right? Where it can be someone who is happy and jolly and they just, it just all, you just put yourself in their level. You can be yourself, which is one of the most important things about being a community health worker, is you have to be yourself to be able to help others, right? And so I think that's the most rewarding part for me. I didn't originally want, not that I didn't want, but I had looked into community health worker to work with women, right? But it didn't work out that way. I ended up in a school health program, which actually turned out to be such a blessing, because it's one thing to help adults, but to help the students that are in need and be a voice for them in the school setting, in the community, is actually even more rewarding, right? Because not only are you helping grown-ups at home, but you're helping students. You're building a bond with them that at the end of the school year, they're all coming into the office, giving us hugs and we're going to miss you and we're going to be here. And, just being a part of their life, it's kind of like you become a family member to them. So it's actually very rewarding.
Absolutely. And you're helping to shape the path of their lives. You're helping to redirect them onto a better path with better health outcomes. And all the work you're doing is so important.
Yes, yes. Not to mention that as bilingual, I love the fact that I can be a huge part of the Latin community and being able to help also the Latin community get the resources because of a language barrier that, they cannot, reach out to. And so even though I do the Spanish, but there's ways to help Swahili or to help someone from Afghanistan or, just someone, there's ways to communicate. There's, translation applications now. And the rewarding part is going home knowing that you made a difference in someone's life. So I think as a community health worker, I think that's the most rewarding part, that it's a selfless job. It's not about you as a person, but you going home knowing that you made a difference in someone's life.
That's so wonderful, yeah. Naomi. Thank you so much for sharing. Yes. And thank you for being here today on this podcast. And I hope you enjoy the rest of CHW Day today.
We will. Thank you so much. Have a great day.
Thank you. You too.